right, welcome back to Pharmacist on Call. Your host, Dr. Shaun Pruitt, community pharmacist of the world. So we're going to finish our discussion. I think I was talking about my staff. Let's see. Yeah, Dr. McKenzie will be having a flu clinic for the state legislators downtown next Wednesday. So I want to acknowledge my technicians as well. First, want to acknowledge Miss Yasmin Polite, who's been with us a few years now, and truly one of the backbones. Reverend Christopher Hall, my longest serving employee. He's a pharmacy technician, he's delivery guy, and the spiritual leader of the pharmacy. So Chris has been with us, man, probably 8 of the 9 years that we've been open as well, and known Chris, gosh, probably since our teen years. So really great to have him working with us. We've got Miss Tramisha Roberts. Want to acknowledge her. She and Yaz have really been the brain trust of the ideas for many of the things. In fact, I credit them for Dr. Pruitt's potion, because they stayed on me about making this and the need to do it. And, you know, I just kind of, I had other stuff going on. So Tramisha and Yaz, you can credit them with the idea for Dr. Pruitt's potion, because they stayed on me until I brought it to fruition. And then finally, we've got Dr. I always want to call her Brittany, but her name is Brandy Dansby. And so she's a recent graduate, so we are waiting on her to pass her boards, and then she'll join us as a pharmacist as well. But right now, she's an intern. And Mr. Amer, I forgot him. He's another intern, so he has finished his boards. He's actually a pharmacist in, I think, either Jordan or Egypt. And so he's done his internship hours with us, so we're waiting on him to pass his things, and so he can join as a full-fledged pharmacist as well. All right, so it looks like we've got us a call here. We're going to get into that. Pharmacist on call, let me help you. Hello?
Yes, Shaun. Hi, Shaun.
How you doing?
This is Lisa.
Lisa who?
Myers.
Hey, how you doing?
Kimbrough.
What's going on?
I have a question.
Yes, ma'am.
Do you have anything that can help me with my H1C level?
You said your what now?
H1C level.
Oh, A1C levels?
Yes.
For diabetes? Yeah, good question. I was going to talk about it a little later. This right here, beetroot juice. This will bring your A1C level down. So what you will do is shake it up really good. Pour a cap full of this juice or two, and then just take it straight out of the cap on an empty stomach first thing in the morning.
Okay, I'm going to come down there tomorrow to give me a bottle.
Okay, and you need to be on the alkaline water too. That combination will bring down your fasting blood sugar and your A1C. So yeah, I'll be there I'll be in the morning about 10-ish. So I'll try to be there when you come.
I'll see you there then.
Okay. All right, Lisa, good talking to you.
All right, thank you, Shaun.
Yes, ma'am.
Goodbye.
All righty, bye-bye. Yeah, for those of you from out east, that's one of the famous Kimbroughs. All right, so we got Joey. Welcome to Pharmacist on Call. Let me help you.
Hello.
Yes, sir. How can we help you?
This is Joey. Hey, I had a question. Do you say anything to the unvaccinated people that come in through your pharmacy, or or should you, or do you?
Do I? No. And so my policy has been to educate you, and then you make your own healthcare decisions. So we don't sway people either way. Unvaccinated people will always be allowed in my pharmacy. Some of my employees, well, very few, because most of my staff is vaccinated, are unvaccinated. So that's your choice. But if you are unvaccinated, you need to do something. And so that is why we do press upon you, Dr. Pruitt's potion, so that you can prepare your body for an insult from COVID-19. So we don't want you to be out there unprotected. We want you to do something to have your body protected if you choose not to be vaccinated.
Yeah, my wife and I are fully vaccinated, and where we live out in Red Bowling Springs, I hear so many cockamamie excuses why they're not getting it. And I've just found out not even to say nothing to them anymore,
Red Bowling Springs, yeah, we've got a whole family out there, the Kirbys, that come and see us every now and then.
Yeah, but like I said, even my neighbors, none of them are they're all unvaccinated. So, I I don't think I should waste my time even saying anything to them anymore, you know?
Yeah, either way, yeah, on both sides of the fence, people are kind of, dug in. So it's one of those things that you kind of let people be in charge of their own health care. Certainly educate as much as possible, but, you know.
Yeah. But also, I've talked to a couple of nurses that quit because they're just so tired of seeing unvaccinated people die, you know, useless. And, you know, it's a strain on them, too. So, you know, but, yeah. But, okay, well, I appreciate your time.
Yes, sir. All right. Thank you, Joey.
Thank you.
All righty. Okay, let's see what we've got here. Looks like we got John. Welcome to Pharmacist on Call. I can help you.
Yes, sir. Yes, I was waiting.
Yes, sir. Yeah, ask your question.
Yes, this is John. How you, Mr. Pruitt?
Pretty good. How are you, sir?
Not too bad. My question was, if you feel tired, what do you suggest help you? You know, I'm just kind of low energy. You know what I mean?
Well, that depends on what it's coming from. How are you sleeping? And can I get you to turn your TV down there, son? We're getting a little feedback there.
Yeah. Okay, I have my TV. I'm sorry.
Mm-hmm.
Is that better?
Yes, sir. Yes, sir.
It's just, my sleeping is not real bad, but sometimes, what it is, I have neck problems.
Okay.
And sometimes I can't get situated and I'll wake up in the middle of the night or something like that. But it's just during the day, you know, like when I get up, I just don't have a lot of energy to, you know, to get going or whatever. It's like I'm low energy or something. I don't know.
Well, I think that's because you're not sleeping well, because that neck is constantly disrupting your sleep. So let's address the neck. We've got a couple of things that we can do. We've got the CBD hemp oil that you can take.
Okay.
And it's going to do a couple of things. One, it's going to really help you to relax, and so you'll get a good night's sleep. The other thing is, it is a great pain reliever. So not only what you do with this is you put a dropper full up under your tongue, you let it sit there 1 minute, and most of the people that we let sample this for free in the pharmacy say the pain is gone in 1 minute or less. So I think that this would go a big ways to helping you. We also have a cream that we sell that you could rub also directly on the neck. I think that that would help your sleep, because this is going to improve the quality of your sleep because of the CBD in it, but also because of the pain relieving effect. Are you having to get up and go to the bathroom any?
Yeah.
All right. Okay. That's what I figured. So you older guys, listen to this. As we age, our prostate it develops hypertension. And so what that does is when we do pee, it doesn't empty all the way. And so we'll have to get up during the night 2 or 3 times, disturbing our sleep. So what I recommend for us is saw palmetto. And what that will do is when you do go, it'll empty that bladder and completely of urine, and so you're not having to get up a couple of times a night.
Oh, okay. Well, see, another thing too, now with that CBO you're talking about.
Yes, sir.
Will that interfere? Will that interfere with? Because I take hydrocodone, you know, prescribed. No hydrocodone. So, will that interfere with that, or?
I don't think it would interfere. It would decrease the amount that you may have to use. You follow me?
Okay, I got it.
Yeah. And so we've had people come off of their pain pills with this. In fact, we've had a couple call the show and say that they were able to come off their meds using this.
I mean, is that stuff expensive?
No. Our cheapest bottle is $20, and our most expensive one is $80. So we're much cheaper than everybody else, but we have a higher quality product because I wanted to be accessible to everybody.
Now, this might be a dumb question, but that one you talking about was $20 or whatever, that bottle. How long does that last? I mean,
a couple of weeks. It's a smaller bottle, so about 2 weeks worth.
About 2 weeks worth.
And then this one will last you about a month.
Oh, the one that was $80?
Oh, no. This one is $40 actually. The one 40 and 80 will last you somewhere between a month or 2, depending on how you dose, because you need less of it the more it goes on.
Oh, okay. I got you. Yeah, I didn't know if that, that stuff that you can buy it at the dollar store. I think it's like B12 or something that comes in a little bottle and you drink it.
B12?
I didn't know if that stuff, I didn't know if that stuff there was any kind. I didn't know if that, what that was.
I don't think it's going to help your situation.
Oh, okay then. Okay.
Yes, sir.
Well, I appreciate your time. Yeah.
Yes, sir. So saw palmetto for your prostate to keep from getting up to pee, and CBD to deal with your neck pain and your sleep quality. And I think you'll be a much better guy after that.
Okay, thank you, Dr. Pruitt.
All right, you're welcome, John. All right, you guys stay right there. We are up on another break. We'll be right back.